Welcome to Struck. My name is Dr.Mek. I'm a third-year neurology resident. My passion is to learn neurology and teach you what I know, more specifically in regards to stroke, so that you will be well knowledgeable and be able to recognize the signs and symptoms of stroke and activate the emergency medical services in time to help yourself, your loved ones, or someone near you. Today, I would like to talk to you about hemispatial neglect. Hemispatial neglect is a neurological disorder where the individual does not attend to the affected side of the world. Classically, it affects the left side of the world. For this reason, it is also known as left-sided neglect. Individuals who have left-sided neglect have no issues with their vision. Their eyes work fine. Part of the brain that's responsible for visual perception is also functioning appropriately. They have no issues with coordination, with motor movement. The problem in this case is that part of the brain that's responsible for attention and 3D spatial orientation is damaged. So where is the lesion? The lesion in left-sided neglect is located in the right parietal lobe, specifically in the inferior parietal lobule. Injury to the right parietal lobe can occur in a setting of stroke, which is the most common reason, but it can also occur in neurodegenerative process such as Alzheimer's disease. But why does neglect only occur on the left side of the world? The current theory, to my understanding, is that both of the parietal lobes are in charge of spatial orientation. The left parietal lobe is in charge of spatial orientation and attention of the right part of the world, and the right parietal lobe is in charge of attention and spatial orientation of both parts of the world, the right and the left. So when we have injury to the left parietal lobe, the right parietal lobe would pick up the slack and we maintain our orientation. However, when the right parietal lobe is damaged, it leaves only the left parietal lobe in charge, and the left parietal lobe is only paying attention to the right part of the world. Therefore, it leads us to have left-sided neglect. How do we differentiate neglect from primary sensory deficit? A situation where neglect can look similar is when a person has what is called homonymous hymenopsia. This means that the individual has visual field cut affecting one part of the visual field input. So for example, left homonymous hymenopsia, which means the individual does not perceive the left part of the visual input, could look similar to neglect, but they're very different. An individual who has a left visual field cut is aware that they have this visual field cut and will make adjustment in their activity of daily living by turning their head to make sure that they are perceiving the entire part of the world. Those who have neglect, however, do not recognize that they have neglect and are unaware of this part of the world even existing. Those who have left visual field cut can have lesion anywhere after the chiasm of the optic nerve tract involving the lateral geniculate, the optic nerve tract within the parietal lobe, or the optic nerve tract in the temporal lobe, or a lesion could be in the main visual cortex located in the occipital lobe. Clinically, we can differentiate these two at bedside by doing several tests. One test we can do is testing the individual's visual field. So we will put our hands up at bedside and we will move one finger and ask the individual to point to the side they see moving. If you move this finger, the individual will point to that. If you move this finger, they'll point to that. But when you move both fingers, which is called double simultaneous stimulation, the individual who has neglect would have inattention to the side that's affected. The test we can perform in the office or at bedside is asking the person to draw a face of an analog clock. Those who have neglect would only draw the numbers on the right side because that's the part of the world they recognize, but individuals who have visual field cut are aware that the numbers go around the entire clock and they will be able to draw a clock appropriately. Another test we can perform is called the line bisecting test. We will put a horizontal line and ask the individual to bisect the line in the center. Those who have visual field cut will be able to put the line in the middle of the horizontal line. However, those who have neglect will bisect the line more toward the right side because their center of the world is different than everybody else who have wider perception of the world. Left-sided neglect can affect individuals differently. Some might have mild symptoms where others might have severe symptoms. Mild symptoms can be that the person is aware that they have neglect of the left side of the world and try to make adjustments as much as they can. In severe cases, the individual will not be aware that there's something is wrong, or they might not claim ownership to the left part of their body. So if they're asked whose limb is it and the arm is put in their face, they might say it's your arm or it's such and such's arm. Left-sided neglect also affects activity of daily living. Individuals would not be able to attend to the left part of the world. They might not know object is there, people are present on that side of the world. They might not acknowledge sound coming from that part of the world. When they are taking care of themselves, they might only pay attention to the right part of their body, shave that part of their face, put makeup only on the right side, eat only on the right side of the plate. And when walking around, they might bump into things on the left part of the world because they don't perceive it. They might push people away, they might hit doorways. One interesting fact about individuals who have left-sided neglect is that their imagination or memory is also affected. For example, when individuals were asked to describe a certain place that they were very familiar with, they were only able to recall the right portion of that setting. The way left-sided neglect is treated is through aggressive rehabilitation. Individuals are put through tasks where the brain is forced to recognize the left part of the world. So in summary, today we talked about hemispatial neglect, also known as left-sided neglect. This occurs when the individual suffers injury to the right parietal lobe, specifically inferior parietal lobule. This causes the individual to neglect or not attend the left part of the world. Left-sided neglect can affect individuals differently depending on the severity of the lesion, and treatment for this is rehabilitation. Thank you for watching. I hope you found this information useful. In the next episode, we'll talk about risk factors for stroke, specifically cardiac risk factors. And happy holidays. And always remember to dial 911 if you or someone near you suddenly can't see, can't speak, can't walk, or can't feel. Let the operator know that you or someone near you might be having a stroke so that you or the individual near you can be transported to the nearby comprehensive or primary stroke center for rapid stroke analysis and tailored treatment.